Hi, my name is Alexis REINBOLT and I'm a physical therapist here in Balance Physical Therapy in Salinas. Today I'm going to talk to you about constipation. So, a lot of you may be surprised that physical therapists can actually treat constipation, but in pelvic floor therapy, that's absolutely something we can treat. So constipation can mean a lot of different things, but it's usually somebody that has a difficult time vacating their bowels or is not going to the bathroom many times a week. So, bowel health is different for everybody. Some people go a couple times a day, some people only go 2 or 3 times a week. So it's important that you go to your doctor and try to tease out what's causing the constipation. But for some people, it can actually come down to their pelvic floor. So the pelvic floor is at the bottom side of our pelvis here, and it forms a kind of hammock. So this is the female pelvic floor. And there's several pelvic floor muscles on the outside, what we call the superficial pelvic floor muscles. If you remove the superficial muscles, you have the more deep muscles, which is the levator ani muscles. And all these muscles help lift the pelvic floor muscles up and keep everything in that's supposed to be in. So it can be a problem if these muscles are too active or a little bit too tight. That can cause constipation. So we're going to talk about some ways that you can work on that here in physical therapy. So the first technique is what's called the I love you massage. And that's a massage that can help kind of vacate your colon, which is the lower intestine. So what you're going to start with first is the letter I. So you're going to have your hand starting here, and you're going to push down the left side of your intestine down to just a little bit lower than your pelvis. You can try small circles or just pressing down. After a minute or two, you're going to do the L part, which is here across your stomach, always to the left, and then down. Again, you'll try that several times. After that, you'll do the U part, which is up, across, and then down. And try that several times as well. Pressure should be fairly deep, and you can also try some circles there. After that, most people need to go to the bathroom. You can also try some stretches to help stretch out your pelvic floor. So find a comfortable position, usually on your bed or on the floor. You're gonna bring one knee towards your chest, hold it there, 20, 30 seconds, and then do the same thing on the other side. It can help to do some deep breaths while you're in this position to try to relax your pelvic floor. Another option is to bring your knee across, or bring your foot across your other knee and push down. Same thing, trying some deep breaths here. Another option is actually on the toilet. So you've probably heard of the squatty potty. You can also just use a stepping stool. I'm going to use one of our therapy stools here. You're going to place that while you're on the toilet, lift your feet, and try to bring your knees up as high as possible. So this is a little short for me, a little higher would be better. And while you're on the toilet, you're going to practice some big belly breathing. So you're going to breathe in, let your belly kind of puff out and out. You should absolutely not be straining when you're trying to evacuate your bowels. If you found this information helpful, please call us to make an appointment, or you can go to our Instagram at BalancePTMove or our website at balancept.com. Thank you.